think we confuse ourselves.
Hello, everybody, and welcome to our regular Tuesday evening. And we're going into part 3 of, I think, quite an important part of the body, which is the elimination. As I said originally, this is the messy part. It's the part we don't always want to talk about, but it's the area of the body that can actually cause a significant amount of trouble. And I saw yet more people today who have gone through the same situation, and it's all diet related, which is a very sad thing to see because, in my opinion, that's preventable. I'm going to share my screen and pull up my talk. And just for continuity's sake, I can tell you once again that this is from the book, Your Body's Sign Language, which has been authored by Jim McAfee, Dr. Jim McAfee, who is a clinical nutritionist. So all of this work that I'm covering is compliments of Dr. Jim McAfee, who is the brains behind everything. I'm just the mouthpiece. So we've done the elimination part with the constipation and various other fun things that we've experienced. And now we're going to the other bit. It's called urine. It's the liquid parts, not the solid parts. And if anybody's ever been to a doctor or been in hospital, you will know that medical people like to look at these rather disgusting parts of our byproducts, because urine and stool can tell a huge amount of things, or a huge amount of information. And this particular one is called pink urine. And this is what happens when urine turns pink after eating beets. I don't know if anybody's eaten beetroots and then they go to the bathroom, and I'm not quite sure why you'd be wanting to look, but if it comes out pink, you've got a problem. And this sign may indicate an iron deficiency or lack of hydrochloric acid, which makes it difficult to absorb iron. And if beets have not been consumed, pink urine may indicate blood, and that is an indication that you need to see somebody very quickly. Now, I do see pink urine from time to time, but it is usually after the patient has had surgery, whether it's urology surgery or gynae surgery. I do see this from time to time, and it is something that one has to monitor fairly closely. Iron deficiency is also indicated by a craving for ice. And this has a very fancy term called phagophagia. And also there are cracks at the corner of the mouth and of the nose. And then there's paleness under the eyelid or spoon-shaped nails and a pale or painful tongue. So there's quite a few indications that your body is going to tell you if your iron is low. So iron is actually extremely important, and sadly enough, also a mineral that is missing in today's diet in a lot of cases. Iron is difficult to absorb the best of times, and deficiency is very common, especially in menstruating women. And this is because of the bleeding. If anybody is bleeding, you are losing iron. And people who don't have any visible signs of bleeding could have bleeding internally in the gut, and that again is a very, very serious problem. Pink urine will usually clear up within about a week of iron supplementation. So it's a very simple test that one can do there. If the red urine color goes away when baking soda is added to the urine, so in other words, you take a sample and you add some baking soda to it, and so the red color goes away, and you can then experiment a bit further if you're feeling bored, and put a little bit of vinegar in there, and the red color, then the red color comes back. Then the red color is from beets and not from bleeding, and you can probably relax to a certain extent. If the red does not go away, the color could be blood, which should be checked by a physician. My recommendation would actually be a urologist, not just a physician. The suggestions: consider a possible deficiency of stomach acid, which inhibits iron absorption. As we've been through the talks over the past few weeks, we've covered a lot of this, And we've seen how important stomach acid is for digestion of not only food, but also supplementation and the various nutrients that go with it. So if your stomach acid is not operating correctly, you're not absorbing things the way that you should do. So you need to have a test for iron deficiency, and that is a very simple blood test that your GP can do for you. I found quite an interesting little picture over here. And it says what your poop and pee are telling you about your body. And the 4 S's that could save your life are shape, size, smell, and shade. So if you're really wanting to get down and dirty and feel like a medical technologist, this is what you need to have a look at. Because the stool bulk and transit time, the slow transit time through the digestive tract means that there's going to be a problem somewhere. Jim McAfee has a little anecdote that he talks about, and he says about the transit time in your gut. And it's basically, I always remember the correct way he puts it, but big stool equals small hospital. Small stool equals big hospital, because you've got big problems. So a small stool, an infrequent elimination, indicates an inadequate fiber intake. And I think if you start to ask people, this is becoming a lot more of a common problem. Several common health problems are associated with small stool and a slow transit time. And this includes a hiatus hernia, diverticulosis, constipation, appendicitis, varicose veins, and obesity. And we've covered most of these things over the past couple of weeks, but this is where issues come up. Sorry. The stool on a high fiber diet can easily be as much as 5 times the weight of the stool on a low fiber diet. Not quite sure who goes about weighing these things, but that is what the tests have come up with. Small, stiff, pebble-like stools indicate a low fiber intake, while bulky, soft stools reflect a more adequate consumption of fiber. So sometimes it's good to check down the toilet after you've been if you suspect that there could be a problem. Transit time refers to the lapse of time between the consumption of the food, meaning going in at the top, and the time it is eliminated in the stool, so going through from top to bottom. Insoluble fibers are preferred for bulking the stool, and soluble fibers are effective in stabilizing blood sugar. So your insoluble fibers act as nature's broom, and they don't only bulk the stool, but they also clean out all the toxins and things. And this is why fiber is so important as part of the detox program, because it's mopping up the excess sugars and heavy metals and things that our body may have and sweeping them out of the system. Pectin, which is also a fiber, is a valuable detoxifier of the digestive tract. And this is why our multi-fiber blend has got your soluble, your insoluble, your pectins, and other fibers all together in one product. The suggestions: add acidophilus to the diet, particularly if antibiotics have been used. Now, antibiotics work, for want of any better terminology. I'm not a big fan of antibiotics, and I am starting to see notices being put up in hospitals and in medical journals. Please limit the prescribing of antibiotics if at all possible. It used to be you had a cough or a sniffle and you went off to your doctor and he prescribed a week's course of antibiotics. And what is happening these days is that antibiotics are overprescribed, and this is resulting in a lot of issues because antibiotics kill bacteria. They do their job. They're very, very effective at doing their job. Unfortunately, they kill the good bacteria as well as the bad bacteria. So we need to replenish the good bacteria if we've had an antibiotic. please do not take acidophilus at the same time as your antibiotic, as you pretty much neutralizing the effects. So my suggestion is take your course of antibiotics, but immediately thereafter, you start with your probiotics, which in our product range is called Acidophilus Plus, because it has 5 billion live bacteria put together in an extremely little potent nuclear bomb. And if anybody's ever had diarrhea and you've taken 2 Acidophilus at one time, you will understand what I mean by nuclear bomb, because that stuff works very quickly and very effectively. And we need to correct the low stomach acid if this is an issue. And there are numerous ways of doing it, one of them being vitamin B. And we need to eat high fiber foods or supplement with a variety of fibers. And we have 2 different sources of fibers. We have the multi-fiber blend, which I've gone over last week or the week before, explaining how versatile it is. And then we also have the fiber tablets. And we also need to obtain all the essential nutrients. Once again, it sounds logical, but it's not always practical. So we need to boost that up. Where are you going to get all your essential nutrients? In one handy spot, our ProVitality. Now, urine, if we think about urine, it should be yellowish. You don't want it looking like clear water, but you don't want it to be glow in the dark either, or any other funny color. So this little color chart I've got on the left over here, you'll see there's different colors of yellow. The first 3 are normal. Number 4 is what happens when you've had quite a bit of vitamin B. And then it goes south from there, because then we're starting to get problems from number 5 through to number 6. So if you can't see the small print, it says numbers 1 to 3, you are hydrated. If your urine matches the colors numbered 4 up to 8, you are dehydrated and need to drink more fluid. And dependent on how dehydrated you are as to what color you're going to be getting. So a yellow or green color to the urine usually indicates nothing more than the presence of vitamin B2, otherwise known as riboflavin. This is a good sign. And if you have our vitamin B complex and beta guard, and for your new customers, they might often phone you in a panic and say, I've started taking vitamin B and I'm now peeing yellow. And you say, that's good. Tell them not to stress. Urine that is unfailingly white is probably issuing a warning that the diet is deficient in B complex vitamins. And you need to sort that out. If you take a supplement that contains riboflavin and the urine doesn't turn yellow, the product probably is not being absorbed. And that is what happens if you have a cheap and nasty off-the-shelf product of vitamin B. Urine yellowness will fluctuate with the amount of water consumed and with the quantities of B2 in the diet. So sometimes it's a good idea to check this out and just monitor yourself, because if you're not drinking enough water, you are going to have problems in the not too distant future. Excessively dark and yellow urine may indicate not only the presence of B3, but also chronic dehydration. And this will often also be accompanied with lower back pain as well, which means that your kidneys are giving you problems and they're looking for some help. Riboflavin at a dose of 400 milligrams daily has been shown to help to prevent migraines, which I found very interesting. This is not a normal nutritional use of B2, but rather therapeutic. And remember, taking supplements, one can take it as per label strength, which is nutritional, or if you're needing to really boost your system, you're ill or you're treating a problem, then you need to double or treble dose. But please do that very carefully and do that in conjunction with your doctor if at all possible, or dietitian for that matter. Researchers in Brazil found that 31 Parkinson's patients were deficient in riboflavin. So that means that people suffering from Parkinson's disease could be deficient in riboflavin. By supplementing 19 of these patients for 6 months with 30 milligrams of B2 3 times daily, it improved their functional motor capacity from 44% to 71% of normal. That is quite an impressive improvement over there. Supplementing with megadoses of riboflavin should only be done under the supervision of a physician who is trained in nutritional therapy. So please check with your doctor. Not all doctors or physicians are trained in nutritional therapy. And if possible, maybe go to a clinical nutritionist or speak to a dietitian who has also had nutrition therapy training. In toxicology, the dose makes the poison. Too much water is bad for you. Sorry. Too much oxygen is bad for you. Arsenic can be safe, but taken in very minute little doses, you can safely absorb arsenic. Make the dose too much, you will die. So in toxicology, they will always tell you the dose makes the poison. The mitochondria, which are the little things inside the cell, if you know your cell diagram, this is where the mitochondria are, is where energy is produced, and they require vitamins B3, B6, and magnesium. And vitamin C reduces the risk of migraines in some people and plays a role in energy production. I know salmon oil also reduces migraines in some people. So this is, for me, quite important as to why we should be taking a wide variety of vitamins, because we don't know exactly what your body needs at any given time. Your body knows that. Give it the tools it needs. Omega-3 oils are an important building block of healthy brain tissue. And because they're missing in the diet these days, that could be very well part of the reason why people are suffering from headaches, eye strain, and migraines. The suggestions: supplement with a good B complex vitamin on a regular basis. And the reason we say B complex, again, I will repeat, we don't know how much B2 or B3 or B6 or B12 we actually need. Our bodies know that. If you give your body a B complex, it can utilize exactly what it needs, because there are only so many receptor sites for those B vitamins. And if you only have a vitamin B12, for instance, it's going to overpower the receptors for the B2 and B3 and B6, etc. And as you know, we have a complete full factor B complex that is derived from brewer's yeast. And that is the end of this particular session. So it's pretty short this week, I'm afraid. But does anybody have any testimonies? I'm going to stop sharing for now. Please unmute. And yeah, let's have some stories.
Sean, a question.
Yes.
You're talking about the urine that is pink when you've eaten beets, and it's a sign the iron was not absorbed. And if the stools are very black, very dark, is that okay? Because then it's absorbed.
Not always, because the iron supplements that you get from the blood banks, for instance, are a synthetic iron and often will cause problems with the gut. And they've checked some of the supplements out there. If you crush up an iron supplement and you run a magnet over it, quite often you'll find iron filings in there, which is not a good thing. And that is why it's so important for your iron to be chelated, meaning that it's bonded with an amino acid, which means that your absorption is close to 80%. My wife has an issue with anemia on a regular basis. And with our iron supplements, she has no gut issues whatsoever, and her iron levels rise up brilliantly in a very short space of time. The iron supplements that she's had from the blood lab cause tummy ache and the black stool and all sorts of other issues. From that perspective as well, black stool could also mean that there is bleeding in the gut, which is often an indication of an ulcer that has perforated, and that needs to be seen to as soon as possible by a physician. Quite often to check that, they will put a camera down your gut or down your mouth or from the other end or both to check and see where that bleeding is coming from.
Okay, so if you know there's no bleeding and you only have black stools when you've taken beet, then you don't have a problem, except that you say that maybe not well absorbed.
Correct. So it could be that there is another issue, or if there's no other outward signs or symptoms of problems, I would say relax, but monitor.
Yeah, because if you don't have like pale eyelids and you're fine with everything else, then there's no
Correct.
problem. I was just wondering.
Yeah, no problem.
Sean, sorry, Linda, carry on.
No, I just want to say that many years ago, a guy told us when we gave him the Formula 4, he said the products are not working because his urine is yellow. So we said no, but it's the color of what is in the Formula 4. It's got nothing to do with the fact that it's not absorbed.
It's
so
a vitamin
that's
B.
why I'm quite interested in the thing of the color of the urine.
Yeah.
You talk about the synthetic iron. Years ago, I remember quite a few years ago, I went to give blood. And the guy, test your blood pressure and your iron. It's either my blood pressure or my iron that makes me fail the don't test. So he checks the thing and he says, oh, your iron is low. So I said, okay, now what? I said, no, we'll give you some iron. You can take 2 months of iron there and come back and fine. All right. So I'm looking at this with a bit suspicious, So I thought, okay, well, he gives it to me for free. Let's see. I take his iron for 2 months, 1 a day religiously and everything, away from tea and coffee and all that kind of thing. Okay. I come back 2 months later to the day and he checks my finger. He says, oh, your iron is low. I say, excuse me 1 second. I said, I have just finished 2 months of your rubbish. And you tell me my iron is low. So he says, oh, yeah, well, do you want some more? I said, no, thank you. Keep your rubbish and I'll take my own good stuff. Thank you. So I got in and I bought a Neolife, box of iron. And and I took 1 month of iron and I went back and I went through with flying colors,
Correct.
It shows you what rubbish they give you, It's total, it's not even absorbed. It's not even go in. It doesn't do a thing. 2 months of this and I couldn't give blood.
Correct.
Crazy.
That's it. And that's the sad part.
Yeah, that's it. And people believe it and think they're okay and everything, and they're taking good stuff. The doctor gave it to me, or the blood bank gave it to me, so it must be good. Yeah, think again.
Yep.
We miss our iron, eh?
Very much so.
They are crying. I've spoken to Liz 3 times, and then they were like having the final supplements to present and whatever, the final trials and whatever, and then came lockdown.
Yeah.
So shoo. And people are still, and they're not happy with the multi-mineral, they want the iron.
That's it. No, we've got lots of customers lined up for that.
Oh, no, I've got downlines that crying, but anyways, okay, we will wait patiently.
Anybody else? And we can cover any of the last 2 weeks as well. Any comments?
No,
questions?
we just appreciate all you teach us and give us. I've got the book, but I don't get time to get to the book. So one day I'll get to the book, but at least you teach us. So I'm very spoiled by the teaching. And it's nice to have that for quick reference, of course.
It is. Yes.
So,
John?
Sean, I just think you answered my question this now about the blood in the stool. But what about some people have blood in the urine? I think that's also quite a serious thing.
Yes, it is. And as I said, that can be as a result of surgery, but it's also, there could be a problem with the kidney. So possibly somebody who has got a massive infection in the kidney, or so you'll quite often find that in trauma cases as well, where somebody's been hit in the kidney, maybe as a result of a car accident or something like that, but also post-surgery. You will, I wouldn't say often see it, but you will see it from time to time. Certain surgical procedures will cause an excessive bleeding. And remembering that your kidneys are your water filters of the body. The liver is the solid filter of solid toxins, and the kidneys filter out all the liquids. So with blood is a liquid. If there's bleeding somewhere along the line, it's going to filter through the kidney at some stage.
Is there something like a bleeding ulcer? Could that be the cause as well?
That could be, but a bleeding ulcer will more often, the blood tends to thicken and dry out in the gut, and that's where your black stool comes from.
Okay, yeah, I don't have the problem. I was just wondering because I've heard of bleeding ulcer.
Yeah, and that can be quite a nasty thing, because that means that where there's a bleeding ulcer, it means that the lining of the gut has been compromised, and you are at great risk of developing quite a nasty infection, and that can kill you. So it's not something to mess with. You get it seen to as fast as possible.
People have problems, eh?
Sean, I've got a downline that is quite heavy on toxin, the antitoxin, the beta guard for eliminating toxins. And he said that there's an odor that actually comes from the urine because of the toxins eliminating out of your body. So that's a good sign. It's not a bad sign.
That's correct. And if people have got a heavy load of toxin in their body when they first take the beta guard, they can sometimes have a metallic taste in their mouth, which is also a sign that it's actually working and it's mopping up those toxins. Yeah. It's a bit of a nasty taste, but it's that metallic taste at the back of your mouth.
Interesting. Don Lawson mentioned.
Well done.
Yeah, thanks for all your input, John, and your research.
It's a pleasure. Now, when I had a look just now to see how far we've come quite far over the weeks. When I look at the chapter breakdown, we've covered a lot of material in the last few weeks.
That's why when I asked you if we could have it in one section, because I've got it here, there. I'd like to make a library of your talks.
Okay, they're all available on my YouTube channel, and if you subscribed to that channel, whenever I upload these things, they're all there, and you can just go straight off to that subscription and download at will or share at will, because I've made all of these publicly available.
Go on to Sean.
Yeah.
Sean.
What I'll do is I'll send you the link. I'll put the link on the group just now for the whole series. For the whole series.
Oh, brilliant! You mean like Sean? So then we don't have to go looking through all the messages to know where that thing that we're looking for is.
You're right.
Correct. Then you can. So when you're on that channel, once you're on my channel, just subscribe, and then it'll come up whenever there's a new recording over there.
Oh, super.
So there's just the recordings on there, or what? You just
all
have the
of
recordings on there.
All of these recordings are on there.
Brilliant.
So if
Thank
anybody
you.
wants the original PowerPoints, I've got them saved as well. I don't like getting rid of anything.
You're lifesaver. Brilliant. Yes.
I think one day you must show us how to file in our cell phones, because my things are all over the place. Thank goodness for the info check. I just go back and now somehow I'd like to take those and put them in somewhere.